evening. Thank you very much for joining us here on Mirror Now. This is Urban Debate and I'm Heena Gambhir. Viewers, a research report by State Bank of India has suggested that the third wave of COVID may hit peak by end of January. It also mentions that with 20,971 cases, the third wave of COVID has already achieved its peak in Mumbai. New cases have been stabilizing. So there's some good news that we've come with us today for you on this evening on Urban Debate on Mirror Now. And we want you to now look at the daily cases that are coming in Mumbai over the last few days. Over 16,000 cases were reported on 12th of January and around 6,000 cases have been reported today from a high of over 20,000 cases that was reported earlier. Now in the national capital, 12th of January and around 11.7 thousand COVID cases in fact have come in a single day today. So there has been a significant reduction in Delhi too. Now we want you to look at what's happening in Kolkata, another important city. Around 7,000 cases were being reported just a week ago and now close to 2,000 cases have come in a single day. Now remember, cities like Delhi and Mumbai were contributing significantly to India's overall COVID count as well. Now, because there has been a slight decline in daily COVID cases in Mumbai and Delhi and in parts of Kolkata too, as a result, India's daily COVID count has been coming down as well steadily. From 2.71 lakh cases that were reported on 15th of January, this is the highest that we've seen in the last 5 days, to 2.38 lakh cases that were reported by the Ministry of Health today. Now, over the next 1 hour, we will try to understand from our panel of experts on urban debate, is it because of low testing rate or is it the beginning of the end of this highly transmissible third wave? That's our big debate on Urban Debate tonight. Let's find out the answers to these very two important questions. Joining us on the broadcast is Dr. Rahul Pandit, Director Critical Care, Fortis Hospital, Mulund, and member of COVID-19 Task Force in Maharashtra. Dr. Subhash Salunke, Senior Advisor, Public Health Foundation of India, Delhi, and member of COVID-19 Task Force Maharashtra. We have Dr. Virander Singh Chauhan, Emeritus Professor, Intl Centre for Genetic Engineering and Biotechnology. Dr. Ravi Malik, CMD, Radix Health Care, joining us. And also we have Dr. Sanjeev Bagai, Chairman, Nephron Clinics. Thank you very much, all of you gentlemen, for joining us here on Urban Debate on Mirror Now this evening. Dr. Salunke, let me begin the discussion with you. Today, SBI has come out with an interesting report. And, you know, in a way, if you look at numbers, at least in Delhi, Mumbai and Kolkata, there seems to be a decline. Your assessment of where we are right now?
Yes, I think this is a very interesting kind of an information sharing done by RBI, and we really do not know what epidemiological parameters they have assessed and because it's not in public domain. But apparently, even the presentations that you have made just before our discussion is an indication that there is a decline. However, is it a real decline or a pseudo decline? That need to be considered. As far as I am concerned, I do not believe that this particular decline is really a real decline. I feel there are many factors which are playing role. One of the very important factor, as has been indicated just earlier, and that is the Government of India, Ministry of Health and Family Welfare has already directed the states to enhance the test capacity and enhance the testing number, indicating that the required number is not that is being achieved by the states. So this is one. So low testing is one part. Number two, the mere number of positivity, or rather mere number of cases is not an indication of reality as far as the present state of the pandemic is, whether it is in Mumbai or Kolkata or in Delhi. Positivity rate, test positivity rate is an indication that still the situation isn't something which is very, very positive one. And also let us try and understand the spillover from urban to rural area is one more step that we have to take into considerations. So putting all these factors together, we all wish for this. It could be a fond hope, but I will be very reluctant to consider that yes, the decline is taking place. We have to wait and consider only after appropriate statistical methods are applied and the test, and particularly at the domestic level, the number of tests that are being done at the domestic or at the home level, nobody knows how many they are there. How many of them are positive? Nobody knows. And that seems to be one of the quite a serious issue or weakness in this entire arena.
Okay, so you're saying that there's an indication that there has been a decline, but you don't see it as a real decline because the testing rate has been quite low as well, and that is clearly reflected in the fresh advisory that has now gone from centre to states, wherein the states and union territories have been asked to enhance testing by the centre. Let's take opening comments from Dr. Rahul Pandit as well. 11th of January, the number went up to about 67,000 odd tests on 12th of January, but on 17th of January, Dr. Rahul Pandit, only 47 odd thousand tests have happened. So, what is your assessment? Because it was the centre only earlier that had urged that, there is no need to test the contacts of a COVID positive person if those contacts are asymptomatic.
So there are two or three things which have happened. One is there is always a Sunday effect. It's across the country. There is a Sunday effect. The tests are a little bit lower on the Sunday. We've known that since the start of the pandemic. So that's not new. The second thing is that with the initial advisory that you only test symptomatic patients, don't test the asymptomatic patients, perhaps the testing has been a little bit on the lower side. And third thing, I agree with what Dr. Sanunke said, that a lot of people are probably testing at home, though Maharashtra and Mumbai have taken up steps. Mumbai has actually asked for Aadhaar card to be submitted while the chemists are selling the home test kit to a person. We would probably come to know what the results of the test are now, because they will be now uploading those things on the app. So we may have a better understanding of the testing. But I think in general, my feeling is that these are early trends and we need to wait for at least a week to 10 days more to see what is happening, because we have always not tracked the absolute numbers. We have tracked the test positivity rate up until now. The goalpost has changed, as I have been saying all the time, that we look at hospitalization, oxygen bed occupancy, ventilator occupancy. All of that remains between 14 to 18% in Mumbai as well as other metropolitan cities. So I think we are still the same. I haven't seen the hospitalization rate or the oxygen bed rate going down yet. And until I see that, I would not be calling it that the wave has started to decline really.
Okay, Dr. Virander Singh Chauhan, what is your assessment of the current situation of the numbers that I just now mentioned about Delhi, Mumbai, Kolkata, and for the country overall? Is it the beginning of the end of third wave, or still it's a trend that we need to really watch out for maybe over the next 7 more days?
So we have some data which we always depended on, where the Omicron was detected first, which is South Africa. The peak, it peaks very, very quick, spread very fast, and actually did come, at least in South Africa, come down quite rapidly. It blew across USA, and it crossed huge number, doubly vaccinated people included. And so this is the property of Omicron. If you look at then Europe, what happened? Because we are, I think, 15 days behind the infection line, as it were. In UK, it went up to more than 200,000. It's come down to about 87,000. All variables keeping in place. Doubly vaccinated, singly vaccinated, whatever the precautions people are taking, masking or not masking. All that being constant, the rates have come down. In UK, they're down to about 80,000 now. So it does seem that Omicron peaks for about 2-3 weeks. In South Africa, even less, and then starts coming down. In Delhi, where I live, if you look at anecdotal around people whom one knows and relatives and friends, the number of people who got infected with the third wave is very large. So whether the other panelists have already said that, I don't want to repeat, there could be multiple reasons. And the biggest could be not testing as many people as you could have. In US, for example, the numbers are startling high. People are testing before going to a party. People are testing at home. The kits are easily available. They are provided by the government. So policymaker in each country, of course, will have to take a decision depending on what resources are available. So in India, it was that if you know you are a contact, you don't need to if you don't show any symptoms. But those cases get added in the numbers that you see in France or UK or in USA. So to answer your question, I think we just must wait. We should watch the situation. But very large number of people are already infected in Delhi. There's no question. And there is no question, at least in my mind, that the Omicron, since it spread very, very fast, and good news is that it doesn't make many people severely ill, that the peak will not stay for very long time. Has the peak come or not? Personally, I think jury is still out. I think the other panelists said we should wait and watch. Let's say it has come, or let's say it hasn't come. Let's say it come in next 1 week, and the numbers will go slightly up and down. But we will certainly see decline. Is this decline real or not? I think it's too early to judge. I would not like to comment on that. It doesn't look correct to me from what we see in Delhi. But could well be peak is right here, and then a decline will start coming in a week's time. By end of January, you should see real peak coming out. That's what my observations are.
Okay. So, Dr. Bakai, Dr. Chauhan is a bit cautious at this point in time. He will like to be in a wait and watch mode probably till the end of January to see whether this declining trend continues or not. But if we compare the data that we have from Delhi as well as Mumbai, the worst impacted cities, at least in the beginning, in the last few weeks, testing has actually come down sharply. For example, in Delhi, over 1 lakh tests were happening till about 12th of January. Now, 18th of January, the data that we've got today suggests that 52,000 tests have happened in the last 24 hours. And similar is the story in Mumbai as well. However, the difference is not too much in Mumbai. The difference in the testing rate. From 67,000, it's about 47. So in Delhi, do you think not enough tests clearly are being done, and that's why we are seeing around 11,000 odd cases versus 29,000 cases coming a week ago?
Good evening, everyone. So I think if you look at just the mere statistics on paper, it can actually be misleading. So let's break it down very quickly. The key points scientifically are that yes, the Omicron variant is less lethal. There are different studies. The South African study has shown it to be 69% as an average in terms of admission, ICU admissions and death as compared to Delta. There is a recent study which has come out from California, which has shown 50% decreased admissions, 75% decreased critical cases, and 91% decreased death, 95% decrease of ventilation and oxygen use, and so on. But if you look at the internal stratification score, it's about 12% less lethal than Delta. Keeping that aside, this is highly transmissible. Without going into the details, this is about 70 times more replicating in the upper airway. It's well into the community. We are well into the third wave and so on. Now, when you're looking at the only published data of Omicron in India, which has come out last week, which is of 25th November going up to 30th of December, that's the last 1 month of last year, it shows almost 51.8% of the population were asymptomatic. Now, when you're looking at a large segment which are asymptomatic and another segment which are very mild, then you are probably have already the largest segment of the Indian population vis-a-vis world population alike, who probably have had a mild infection with no external manifestations, and within 3 to 5 days or 10 days it goes away. The other major cause of the numbers being misleading as far as the statistical value of number of tests concerned are, I would say a large population are now relying on home testing. which till recently, apart from Bombay, almost every city in India is unreported. And even if it is positive, it is unreported. If it is negative, it is unreported. The timing of the test is not as accurate because they're doing it on their own will. If you do it too early, it's negative. If you do it after day 5, day 6, again, it becomes negative. So your window period is day 2 to day 4.5 to 5. So having said that, I will not pay too much of attention on the test positivity rate because that's a misleading sign. I will focus on total number of patients being admitted. I want to keep the admissions low and the death rate low. And the last important point I want to make is the pediatric population so far in India, which is extremely surprising and extremely heart-warming, has been spared. The largest segment of Indian population is pediatric 0 to 18. If you see the worldwide data, there is a 200 to 300% increase in pediatric admissions. Even today, the data has come from US that the hospitals are being overwhelmed with the pediatric patients. There is something which is protecting kids, and so far the Indian kids have not had that kind of surge of admissions. The warning sign is that we are running about 2 to 4 weeks behind the Western countries. The Indian population, especially the pediatric population, is 49% asymptomatic as far as SARS-CoV-2, indeed Omicron, is concerned. We have to be careful because the multi-inflammatory syndrome of children, what we call as MIS, presents 4 to 8 weeks after the asymptomatic mild infection. So I will not put my guard down. I will not pay too much of attention on the statistical value of the test. I will continue to test. I would like a proper protocol to track the home testing so that we get the real number. I will keep the pediatric population, even with mild fevers, under very close watch for 4 to 6 weeks at least after the fever disappears. And I will focus on the hospital numbers to keep the statistics down. Over to you.
Okay. Okay. Dr. Ravi Malik, what is your assessment? You've heard the numbers from 3 important cities in the country, the overall numbers that we are seeing. I mean, even though the number of tests are down, the positivity rate is down too. Why should we not look at that as an important indicator to assess what's happening? Because in South Africa too, the peak went up sharply and then it came down in the similar fashion.
Look, it is too small a period to comment upon the situation on the ground. In bullet points, I will like to enumerate few things. Number one, what we are seeing is the tip of the iceberg. Now, the total number of cases in a country where the population is 140 crores and we are testing 16.43. In last 24 hours, we have tested 16 lakh and 43,000 cases. So it is a very small number what we are testing. So what we are seeing, there are many hidden patients which are there. Second very important bullet point is that we are not testing any of the contacts, the asymptomatic patients. And the third very important thing is that people have started testing at home, which was not prevalent during first and second wave. So how many cases are being hidden? The moment they come positive, they don't report to the authorities. So they never reflect in the numbers. Very important fourth point is that it also depends upon the number of tests. Like you have rightly said that in Delhi, almost 1 lakh tests were done on 12th of January. And today, if half of tests are done, then the numbers will be obviously be doubled if we double the number of this thing. So I think 5 days period is too short a period. And in no way I will like to give any confidence to the general public that this wave is now going. It has already achieved the peak and it is now coming down. Because the moment people start feeling confident about it, again, you will see the social spreader events and this thing. And we are walking on a thin line. We must understand this thing. And the numbers can be deceptive. In such a huge country, the numbers can be deceptive. In last 24 hours, if you see in USA, we have even in last 24 hours, today also we have seen more than 7 lakh of cases. The peak has yet not gone in US for that matter, and the cases are increasing over there also. So having said that, obviously, we will keep an optimistic eye on the numbers, but in no way we are declaring that, the peak is gone and the storm is almost going to get over, and because it is going to give unnecessary false confidence to the public. And also we should keep an devil's eye on this
You're
monster
right, Dr. Ravi Malik, when you say that we can't really afford to lower our guard down, but your reason behind discussing this particular issue was to give people a bit of hope. This too shall pass because, there are restrictions which are back again in our lives, but then this was a glimmer of hope, we can say, that also came this morning, this SPI report which suggested that, just like the second wave, even this has started declining.
I fully agree with you that there is definitely a ray of hope which is coming. And you have rightly said that we should not lower our guards. It is very important, and it is a very important message which you and us, we are all giving to the public, that let us not lower our guards. But definitely these reports which are coming are little encouraging. But we need to keep our fingers crossed, and we need to observe the situation. Our epidemiologists should keep an visual eye on the situation on the ground, what is happening, and at the same time, we should be optimistic and positive also. And if not now, maybe within 2 weeks' time, I think this wave is going to pass, as it has passed in South Africa and many other countries. So it has to go. There is no doubt about it. But the only thing is that we are little concerned about our children and our elderly people, and of course the people who have comorbid conditions. So we should keep them absolutely safe, and we should of course not be fearful about this illness, but we should be extremely careful about the disease.
Okay. Dr. Pandit, I want to now ask you about if there are any similarities that you have seen between the way this wave is behaving in terms of how it is spreading in different parts of the country with, how the situation was during the second wave. I'm not talking about severity here. I'm talking about the way it is, moving quite fast, the way the cases are increasing, on transmissibility factor specifically.
I agree with you completely. The transmissibility in the Omicron wave has been absolutely unimaginable. I mean, we've never thought the rate at which the cases are spreading across the country. It started off with clusters in the metropolitan city, which is obvious because that's where the density of the population is. That's where people are moving around. That's where people actually landed up on the airport. So obviously it started with Mumbai and Delhi, then spread across to Kolkata and Bangalore. And now we are seeing it spreading across to the tier 2 and tier 3 cities. It is almost as close to any fast moving, fast spreading, beg your pardon, virus which we have seen. We used to talk about chickenpox virus, we used to talk about measles virus. This Omicron variant is right there, right at the top in terms of its spreading power. It can infect large number of people within a short span of time. And previously, we used to say that you need to spend at least 10 to 15 minutes in the room before a person can get infected. Here, we are talking about matter of minutes. We are talking about matter of minutes where a large number of people in the room can get infected. Hence, the whole importance about cross ventilation in the room, giving actually a large important aspect of your day-to-day life should be how well ventilated my room is, how well open my cross ventilation is happening in my room of where I'm working or where I'm sleeping. I think these are some of the things which we need to be very, very cognizant of. The other thing which we also should understand is that there is still some amount of delta there. With all the genomic sequencing happening, there is still some amount of delta there. Percentages may vary from state to state, from city to city, but we are seeing delta there, which is definitely present, and we are not able to, within the first few days, differentiate clinically between Delta and Omicron, because both of them may behave in a similar way. So please keep your guard on. Please keep the COVID timetable still remains to around 14 to 21 days. You need to remember to keep on your guard for at least 14 days. Don't just think that this is a mild flu and it will go away in 7 days and then you don't need to worry about it. So keep up your guard for 14 days. Make sure that people have that understanding.
Okay, it is not mild. That's the message. Keep your guard up at least for 14 days if you are infected with COVID in this particular wave. Dr. Chauhan wanted to make a point as well. Yes, sir.
I just want to review for your viewers. You can hear so many things that will say, is it mild or not? Some would say, well, it's mild, it's not. Some would say it's like a flu. I think let's be very clear on this. That Omicron, which has hugely large number of mutation, does spread faster, is milder, but would infect very large number of people. Milder doesn't mean that it will not cause grief. It is not that it will not make some people or some, although the percentage of people who will get severe disease will be much less than the previous one. All that has been said. I think the viewer should take home this message that it's better in any situation to know whether you're infected or not. Whether policymakers at a given time have enough access or make enough access to affordable, easy to use, even if it's the 90% the validity of the test. I think it's always better to know whether you're infected or not. So saying that I'm a contact, I am asymptomatic, therefore we should, then you'll have situation like you and I are discussing right now. We don't know whether the peak is there. Anecdotally, as I said, there's a very large number of people who got infected. So the situation may be very different than what we are looking at. It is now there is enough data. There wasn't enough about 3-4 weeks back. That it doesn't lead to so many hospitalization. Not so many people would, but it is not like flu. It is different from flu. It may be more severe than flu. It's long-term. It's only discovered 2.5 months back. It may have repercussions that we don't know. It's too early to say this is going to go that. It is silly to think it is flu-like, but it's silly to think it is as silly to think that it may cause huge amount of severe disease. It won't. What scientifically is very important that if you have the virus, we should not allow the virus to multiply or to replicate as much as it wishes to. In other words, we must do everything to slow down or stop the pandemic, because more chance, whether it's in Africa or in India or in California, more chance the virus gets to replicate. There are more chances you might have something more vicious than the previous ones. Hopefully not. That's not the viruses behave. Viruses do behave the way Omicron is behaving right now. They begin to find peace with the host. So I would say to the viewers, be extremely cautious, take it extremely seriously, but there is a glimmer of hope, but that should not lead to celebrations into, oh, this is very mild. So glimmer hope should be, we should hang on.
Do not begin celebrating. Okay, of course, do not start celebrating yet. There is a glimmer of hope. You agree to that. Dr. Salunke, now, going further in the report that SBI research has come out with, it says that share of rural districts in new cases has increased to about 32.6% in January 2022 from 14.4% in December 2021. Do you see some kind of a similarity between the third wave and the second wave, the way it is spreading? It started, from Mumbai, Delhi, other metro cities, and now entering into tier 1, tier 2 cities. Tier 2, tier 3 cities now, sorry.
Exactly. I think that is the real risk. What we are seeing right now in Mumbai and in Delhi is going to be a kind of an expected decline. But the spillover that is going to take place in the rural area is going to be a major issue. Another major issue is the states where the elections are going to be there. And we know people how, political parties and people come together, and nobody is going to bother about, COVID appropriate behavior unless there is going to be a kind of restrictions that continues with the election commission's kind of directions. So that is another risk that we have to take into consideration. Third risk is that there are sizable number of people in our country, in spite of 160 crore people being vaccinated, still there are sizable number of people, and that number runs into crores who have not even taken either one dose or both the doses. So there is a sizable number which is very vulnerable. And the next point is that right now, the circulation of both the Omicron as well as the Delta is there, and the possibility of Delta Omicron coming together and deriving into a newer variant can't be just ruled out. So that risk is also there. And from that perspective, as far as our country is concerned, you cannot consider a national picture. There is no national picture as far as the states and the districts are going to be the units. And from that perspective, decline that you see in Mumbai need not be a decline in Thane district or in Palghar district. The decline that you see in Delhi need not be seen at the same time in UP or in Haryana. And the situation is so different between these states in the rural area, our health systems in the rural area, irrespective of the fact that we go on praising ourselves, the situation of the health systems, in particularly public health system, is a worrisome one. So with these all factors put together, we have to be extremely careful, and has been indicated by my colleagues, panelists, I will be extremely reluctant to say that we are out of the woods, or we are likely to be out of the woods just in next 8 days or 15 days as a country. No way. That is just out of question. And we have to follow the strict vigil. We have to have some restrictions. Some, like, night curfews and weekend curfews, those are the things which are just cosmetic. They don't have much relevance. But the restrictions which will ensure that people do not congregate, and particularly in an enclosed space, need to be followed. Unless we follow that, and we will not copy exactly as has been seen in US or in Europe, India is likely to present itself in a different fashion from urban to peri-urban areas to rural areas. Things are going to be different. So let us keep ourselves completely prepared to face this battle for next few months, not few weeks. And I personally feel people in general, we have to keep in mind that we are still we must prepare ourselves to fight this battle for next at least few months.
Okay. Important point you're making. Next few months, of course, we need to be extremely cautious because, Dr. Bagai, even though new case count might be stabilizing or, at least looking slightly better as compared to last few days in Mumbai, however, cases in places like Bengaluru, Pune, still witnessing a sharp spike. And talking about the rural district specifically, where new case count is going up, do you think now probably the need of the hour is to have a different kind of strategy to deal with the rural pockets of the country where many still are not wearing the masks properly, and this variant is highly transmissible, so we can't really take it lightly this time around as compared to Delta?
Absolutely, Heena. A couple of important points. I think the issue of this running and starting initially at different intensities at different parts of the country has been in different timelines. So all the states, one size fit all, are not running the same trajectory of the cases or the time of severity of cases or the caseload. So I think there is a modeling study which has shown a very detailed enzymatic energy study on the amino acids of Delta versus Omicron. So the Delta wave per se runs from 75 to 90 days at an average, and this is supposed to run between 30 to 45 days, and then it plateaus off. So we are around the time in which it will start plateauing off. But the important points here are, this is unlike what Dr. Kapoor mentioned, unlike anything else we have seen in terms of contagiousness and transmissibility. The most contagious virus so far has been measles. It's a well-documented fact. Again, in international publications, Omicron is running R0 of 12 and above. I have never seen this in my 40 years of being in medicine. So transmissible. You need an exposure of less than 5 to 50 seconds, less than a minute. There was a Lancet study last year which showed long jump COVID. There is a study this time which has been shown even in quarantine centers that one patient can infect another, what we call as fly COVID. So your person need not be in the room, but the virus can linger on for more than 9 hours in the room. So I think masking, so where I'm coming to is masking is important. But the message we are giving is wear a mask. We are not giving a message which needs to be given as what type of mask and how to wear the mask. That needs to be hammered in. It's like saying, please wear clothes, you're going to Alaska. If you wear a t-shirt in Alaska, you will freeze to death. The point is we need a high specification N95 mask or a double mask, and it has to be fitting properly. I think a complete revised public awareness campaign needs to be running, not only for this month or the month after that, for better part the entire year. The last point which I want to make is everyone is saying quarantine for 5 days, stay at home. You know, it's a WhatsApp message going from one colony to another. The fact is that this virus peaks between 3rd to the 6th day, but the live virus is alive till 9.8 days. That means till the beginning of the 10th day, you are still harboring a virus which is infectious. So 13% of people with Omicron can continue to harbor live virus even after 10 days, genetically. So the quarantine period, as far as safety is concerned, should be at a minimum of 10 days, preferably 14 days. Going forward, masking, going forward, double vaccinations, and the vulnerable groups, the third vaccine. There's a study which has come out today, Heena. Allow me to quote that the Omicron infection reignites your old reservoir of your antibodies which have been given to you by the double vaccinations and re-energizes them to give them more breadth. Breadth means potency. So your vaccines are being actually rejuvenated by even a mild infection of Omicron. That's why our case fatality, one of the reasons, is still very low in India, is because of the most phenomenal vaccine drive the earth has ever seen, which has occurred in India. Over to you.
Okay. Okay. Now I have a question for Dr. Ravi Malik and Dr. Rahul Pandit, and I want both of you gentlemen to explain to our viewers how has been the situation as far as admissions to ICUs this time are concerned, because experts from South Africa also, Dr. Ravi Malik, seem to suggest that, you know, don't look at the positivity rate or the number of cases that you're getting, but actually you should see how many people are admitted in the ICU. So what has been the trend really in this wave, especially over the last few days? Dr. Ravi Malik first, then Dr. Rahul Pandit.
Look, since I've been running COVID hospital for last almost 1.5 years, and we have seen the first wave, second wave, and now this wave, significant things we are noticing. Number one, that this Omicron virus is not making the patient sick. The pneumonias the percentage of patients who are getting sick is very less. And the chances of getting pneumonia, the chances of getting desaturation or falling of SpO2, what we call it, they are also less as compared to the other variant. And the number of admissions in the hospital and more so in the ICUs are definitely less as compared to the other variant. Now, having said that, I must also put a word of caution that we cannot shrug this illness as just mild or just like flu-like illness, and we should take all the precautions. But there is no doubt about it that, you know, medically speaking, what happens is that Omicron is not able to form the syncytia. The syncytias are not able to form in the lungs, and so multinucleated giant cells are not formed, which leads to further formation of pneumonia and subsequent fibrosis later on, and falling of the SpO2. So this is one important point which I will like to mention. But having said that, we need to take all the precautions.
Okay.
We cannot ignore this illness as mild as WHO has rightly said, that all the variants of COVID, including Omicron, they can be life-threatening. One very important point I will like to tell you, most of the people say that, no, forget it, it is just like a flu, it will go. Even flu kills 6.5 lakh people on this planet every year. So we cannot shrug it off that it is just mild flu and it will go away. We need to be extremely cautious and careful. Definitely, there is no doubt about it that it is milder as compared to
Dr. Rahul Pandit. Okay. Dr. Rahul Pandit.
Yeah, there are two different things which are happening. One is what we call as a bystander COVID or incidental COVID. So there are a lot of ICU admissions which are coming up, which are incidentally found to be COVID positive. I have had traumas which have come and they have been found to be COVID positive. I've got strokes, I've got myocardial infarction, GI bleeds, patient posted up for surgery who have turned up positive, so on and so forth. And they are some of them are actually needing ICU care, not because they have pneumonia, but their primary disease warrants them to be in ICU, but they have tested positive. And that's just purely because of the high test positivity rate which we have in the population. 1 in 2, 1 in 3 is getting infected, 1 in 4 is getting infected in some places. The second is what I agree is with Dr. Malik. Some patients are still coming to the ICU who are requiring high flow oxygen. We've got a couple on ventilator as well. We've got a few in the city of Mumbai who are on ECMO as well. So it's not like it's all mild disease, but the number is very small. Thankfully, it's very small. Nothing compared to what we saw in Delta. So the number of people who are requiring oxygen because they have got COVID pneumonia is probably 1/5 of what we saw in the Delta wave. So maybe 20% of what we saw in the Delta wave is what I'm seeing right now. But I would like to just wait for another 2 or 3 weeks, because we always see that the illness follows, and that illness follows with the second week or third week presentation of patients. So Mumbai really started clocking up cases after 24th, 25th of December. So we are in around third week. I would like to wait for another couple of weeks before I could say that with surety.
Okay. Last word I want to give to Dr. Chauhan. Of course, we all are of the view that, we can't see the declining trend as, the peak in Mumbai and other cities. We have to still wait and watch. When will, this COVID really go away from our lives, or will we always keep on seeing these new variants emerging?
Very quick 2 points. One, which is you have not asked me, but I really want to address your viewers. For much we have spent time, all of us have been saying that the Omicron now, with so many mutations, does escape the immune responses as far as infections are concerned. That is seen in US, that's seen in UK, very high rate of double vaccination, and yes, people coming down with this. So good thing about vaccination, and I think viewers should just note it down, why vaccination and double vaccination and later on boosters are necessary, because that they protect you from severe disease and hospitalization and therefore death. All of us are saying the same thing. But this confusion that I am doubly vaccinated, why am I getting infection? I think the viewers should understand that there may be lesser chance, but it is quite easy to get infected even if you're fully vaccinated. It protects you from severe disease, may not protect you from this. The other question,
right.
What is the other question you asked? This is not what you asked. The other question you asked was?
Will it ever go away?
Oh, yes.
COVID pandemic, will it ever go away?
There is absolutely no doubt that absolutely no doubt. There's no history. The viruses will go. They definitely go. I'm very categorically, as a scientist, as a citizen, as a responsible spokesperson of the society, as of course, and it might be sooner than later. But as I said, this is the time to be extremely cautious. Let us not let the virus multiply at will. And I think we will conquer it. Definitely, yes. We have much better tools. 2 more new drugs are coming. There are 3 oral treatments now. So toolkit is increasing. Humans are increasing the toolkit. So I think there is much more hope than you would think when you see.
By middle of this year, this particular virus, if it doesn't mutate into further transmissible and virulent virus, we will have endemicity. By June, I expect it will become an endemic kind of a disease.
Absolutely. But don't let it multiply.
Oh, fantastic. That's a very, very important point. I'm completely out of time, but that's a very important news that you've given to us, and fingers crossed, we are all going to look forward to that very, very closely. Till then, we have to ensure we are following all the protocols properly, especially the mask and social distancing that needs to be followed. With this, I thank all my guests for joining us on Urban Debate. Heading into a short break, but there's lots coming up for you on the other side.